Hey, I'm Tamara Kendacker, and you're listening to The Decibel from the Globe and Mail. So on Friday, after we finished making the day's episode, I drove up to a clinic in Scarborough and I got my second dose of the COVID vaccine. The doctor told me congratulations and said that the full effects would take about 2 weeks to kick in, and I gotta say, I almost cried. Most of my friends and family are now also double-vaxxed, and I've just been waiting for the all clear. When can we finally go over to each other's houses and hug each other without being scared? And I'm sure a lot of you've been wondering the same thing. That's why I was so excited to see on Friday that the federal government finally released guidelines for fully vaccinated people and laid out how we should behave in a number of different scenarios versus people who are partially vaccinated or who aren't vaccinated at all. And the guidelines are meant to be simple and easy to follow, but they aren't exactly black and white. And the Deputy Chief Public Health Officer acknowledged that during the press conference.
For example, the CDC guidance, it makes it seem straightforward. Yes, I have my 2 vaccines. I can do whatever I want. And we're saying, no, it's much more nuanced than that. And you can see by the tools that there's also a level of what I would call your personal sort of a risk assessment and risk tolerance.
And they're going to force us to have some pretty awkward conversations.
It's hard, and this is going to be the difficulty coming out of the pandemic, is how do you manage these different attitudes of the public when you could maybe unknowingly be put at risk by someone else's behavior.
The Globe's health columnist André Picard is back on the show today. And with the long weekend coming up, we thought we'd try to answer some of the questions you might have about what you can and can't do if you've gotten your second dose, and whether the time for worry is actually over. You're listening to The Decibel. Hi, André. Welcome back.
Hi.
So the federal government has finally released guidelines last week on what you can do when you're fully vaccinated, and experts have been calling for this for a long time now because the U.S. had released similar guidelines back in March. So I guess just to start off, why has it taken so long for these rules to come out?
I think there's a couple of reasons. One, we have this eternal federal-provincial distinction, so the feds don't like really to give out rules because it gets the provincial noses out of joint. So there's that. And then the second part is I think there's just this ultra-cautiousness for public health because it can't really win. Anytime you put out guidelines, they're invariably going to change. And then people start going, oh, no, you're changing the rules. You don't know what you're doing, etc. So there's no right time to do this. But I think in the end, the guidelines they've got provided are pretty common sense and easy to understand, which is refreshing for the Public Health Agency of Canada, to be honest. They're incomplete, but what we have is pretty decent.
Okay, so let's just go through the rules and some of the inconsistencies because there are quite a few scenarios to consider. So according to the federal guidelines, for people who are fully vaccinated, what can you do if you are gathering indoors versus if you're gathering outdoors? What are the different rules that you have to follow?
Well, outdoors has always been better. We know the risk of getting infected is much, much lower outside. So if you're having a camping, family barbecue, etc., no mask, no physical distancing, you get some freedom if you have a vaccine. Same indoors with smaller dinner parties of friends. If everybody's vaccinated, you're watching the hockey game together, you can hug. And then even larger groups, if you have contact sports or a birthday party, still no mask or physical distancing. So again, lots of payoff for being fully vaccinated.
And how does the advice differ for people who are not vaccinated or who've only received one dose so far?
Pretty well, the masking continues, the physical distancing continues, and especially when you get indoors. Indoors, much more harsh language about always wear a mask indoors if you're not vaccinated. People who are vaccinated, there's a lot more freedom there in the guidelines.
But there is a huge chunk of the population that isn't vaccinated and probably isn't going to be for the whole summer and possibly after, and that's children. So one of the criticisms of the guidelines is that they don't address how we should interact with unvaccinated kids and what precautions they should be taking. So what does the government say about that?
Yeah, that's been a big hole in the guidelines is what to do about kids, and I'm not sure why they didn't address it. If we look elsewhere, well, essentially what they say is kids should have a lot more freedom. They're at less risk of being infected. Their illness is less severe. So give ourselves some leeway. My favorite answer to that question was Dr. David Naylor, who's head of the Immunity Task Force. He said, you know what? I'm just going to hug my grandkids. So go with your gut. I think there's a lot to be said there. I think it's difficult, say, parents who want to travel with their kids, what do you do? I think probably it's going to depend on individual risk tolerance. You might want to mask them up to go into a restaurant, not do it, at the beach. You're fine, you're outside. So I think parents are going to have to find their comfort zone with kids.
But with kids, there has been this worry about MISC, which is multi-system inflammatory syndrome in children. And is that something that people should be worried about?
I think it's something we have to be aware of, but not overly worried about. It's pretty rare, but it is a severe condition. There's inflammation of organs and tissues like the heart, the lungs, the kidneys. So it can be very serious. Early on in the pandemic, we thought kids had Kawasaki disease. So it's very similar to that, but a little different. So we have to watch for it. It can happen in some adults too, but it seems to only happen in children.
Mm-hmm. So these federal guidelines, they are just guidelines, and there are a lot of settings that are under provincial jurisdiction, like restaurants, for example, and some provinces are moving much more cautiously. Like in Ontario, for example, we can now have tables of 6 for outdoor dining, which is obviously not as liberal as the federal guidelines are saying. So why is that? Why are some provinces moving so much more slowly?
Yeah, the distinction, the federal guidelines are more about what individuals can do, and then the provinces are setting rules for what happens in public. So there's a little bit of a distinction there. We know that we didn't have a single pandemic in Canada. We had very different outbreaks in different parts of the provinces, so that is reflected to a certain extent in the rules. There's some places where there's less tolerance for lockdowns, both from the government level and the public. So we see this real hodgepodge of rules. But I think overall what the rules say is the more people are vaccinated, the more stuff you can do.
So with these guidelines, the thing that seems challenging to me is that they kind of assume that we would know other people's vaccination status, right? Like they say, if everybody's fully vaccinated, don't worry about wearing a mask or physically distancing. But there's actually no way to know whether someone's been fully vaccinated. So how do you deal with that?
Yeah, it's true. We don't know if people are vaccinated or not. It's something you disclose whether you want. Where it gets complicated is in the public settings. And if you look at the rules are much more vague the larger the settings get. And it's for that reason. We just don't have any idea. The reality, too, is these are guidelines. We can't force people to follow them. People who don't like vaccination, who have no intention of getting vaccinated, who don't like masks, they're just going to do as they do. They're not going to follow these guidelines, right? So it's hard. And this is going to be the difficulty coming out of the pandemic is how do you manage these different attitudes of the public when you could maybe unknowingly be put at risk by someone else's behavior?
I wonder, what advice do you have for people who are hoping to go to some sort of gathering this weekend where there's going to be mixed company and they maybe don't know everybody who's going to be there? Like a lot of people might feel awkward about asking a stranger about something so personal, or even asking someone that they know about something so personal. How do you have that conversation?
Yeah, I think it's hard. It's very personal. Some people will take offense, etc. So you have to find your comfort zone. I was watching a WHO press conference a couple of days ago, and they were saying, be appropriately cautious. And I thought that was interesting wording. Err on the side of being cautious. If you're not sure, you don't know that family, maybe just avoid them. I was on an elevator yesterday, in the building, it's like 2 are allowed, 3 is tolerated. So you sort of negotiated, and someone's standing at the door and they said, oh, I've got my 2 shots. And both people said, oh, get in. Mm-hmm. I think that's what life's going to be like for the next little while. We're going to find our ground, and we're going to do as we do in everyday life. We're going to judge people based on whatever, these gut feelings, these looks, whatever.
tell me about how Canada is doing in terms of vaccination rates. Like, where are we at, and how confident should we feel about fully reopening?
Well, we're about 35.5 million doses have been administered. That's 67% of the population has at least one dose, 26% two doses. So the two-dose numbers are rising rapidly. So yeah, we're in a good place. It's one of the highest rates in the world, but still a large number, still a third of people have not had a single vaccine. It gets harder and harder to reach those groups as time passes. You get them more and more reticent. So we have to be cautious about that. We're seeing Delta variant numbers rise. That's also a concern. So there's little cautionary bells that should be ringing. But overall, yes, we have to reopen. And we have to, I keep stressing this, we have to reward people for being vaccinated. That's the only way to keep the momentum going. It's the only way to give some people hope that this is going to end.
What do you think we can learn from places like the UK and Israel, where we've seen a resurgence of COVID cases despite very high vaccination rates?
I think it's a reminder that when there's an outbreak, you have to shut down quickly. And when you reopen, you have to do it slowly. I think we have to be prepared for that. We can't freak out when we bring in new measures temporarily, when we bring back some rules. I can almost guarantee that in a province by mid-July, there's going to be some province bringing back some restrictions because they're going to see a spike somewhere.
And for listeners who maybe haven't been following the situation in places like Israel, what happened there? Why are they seeing a spike in cases?
Well, I think it's pretty simple. Israel vaccinated quite aggressively, did a large number of the population. They were very proud of it. They opened up. They probably opened up a little too quickly and a little too broadly. They got rid of their mask mandate, so now they've brought back masking. They've realized, we've vaccinated 70 or 75% of the population, but there's still that other 25%. And there's still a lot of people who don't have their second dose. Israel is very similar to Canada, but they've got about a month or a few weeks advance on us. So I think they're really one we should pay attention to. It's really a cautionary tale of what could happen in Canada if we get a little too cocky.
So we've been talking about how we have to kind of go with our gut, and we can have these conversations between ourselves about, whether or not we're fully vaccinated. But I think a lot of people will still want certain reassurances before they feel comfortable going into public spaces or going into a business like a store or a restaurant with strangers. So should we have a system in place that lets people prove that they're fully vaccinated, a vaccine passport like we've seen in places like Israel, for example?
Yeah, I think it's very unlikely we're going to get a one-stop shopping vaccine passport. There's all kinds of civil liberties issues, practical issues. We have terrible electronic medical records in Canada. We don't have a vaccine registry, even for children. We don't know if you move from one province to the next. Doctors have no idea if a child's vaccinated. So we have to figure out how to have some kind of registry. We have to have your vaccine status on your electronic health record. This is the reason that Israel was a leader in vaccination, is they have terrific medical records. So they were essentially used as a living laboratory by the vaccine companies to figure out how immunity is working, because it's so easy to track people given the records. But I think overall, we're just going to have to push everybody to get vaccinated, looking for these technological fixes, cards, passports, etc. I think that's kind of a mug's game. You have to just aim for getting the virus to not spread in the community. So it's kind of an old-fashioned way of thinking, but I think that's practically where we have to go.
So what is the latest on this front in Canada? Like, are there any contexts where we definitely will have to prove that we're vaccinated that you know of so far?
Well, I think the clear one is coming into the country. So we have rules about coming back into Canada, whether you're a Canadian or a foreign traveler, you have to demonstrate that you've been vaccinated. And if not, you have to go into this quarantine. The quarantine rules have changed, but that's a striking example. That's probably going to continue with airline travel. There are already several countries where you have to show proof of vaccination for other things like yellow fever, etc. So I think that's going to be the norm. I think we'll probably see it in some workplaces. Workplaces will want to be cautious about whether their workers will spread to others for legal liability reasons. But I don't think we're going to see we might see it in schools. Schools have mandatory vaccination in some provinces. Again, it's a minority actually in Canada. Canada doesn't have a history of mandatory vaccination. We kind of trust people to do the right thing. So I think we'll probably continue that in many provinces. The only one that's been really explicit about this is Alberta, saying, there's no way we're going to ever demand that you show proof, which again, sort of a libertarian conservative view. But overall, I think we're just going to see little sporadic demands for proof of vaccination.
But could mandating vaccines in certain contexts, like say, you have to be vaccinated to get into a concert or something like that, could that incentivize people who are vaccine hesitant, which is one of the things that's preventing us from reaching population level protection? Could that incentivize people to get the vaccine? Have we seen evidence of that?
I think it could theoretically incentivize people, but I think it's really difficult. Just imagine the technical detail of who's going to figure that out. You're 25,000 people going to a concert. Who's going to check that you're vaccinated? How are they going to do it? You're going to have some app on your phone. Is it going to be easy to cheat? For the most part, people who are vaccinated are going to be proud of it, and the people who want to cheat are going to figure out a way to cheat. So I've never been a big fan of mandatory stuff because I just don't think it's practical. For the most part, I think we just have to, as a society, expect people to do things and then have rules for those who don't and put others at danger.
People want certainty. They want to know that if they are fully vaccinated, that they're protected from COVID. And what do you say to those people?
Yeah, I think you're right. That's why people want these guidelines. They want rules because they want things to be predictable and they want things to be certain. But what a pandemic is all about uncertainty. We just don't know what's happening in a lot of instances. So it's hard for governments to have clear rules. It's frustrating for the public when there isn't clear rules. But that's what we've learned, I think, in the last year and a half, is we have to figure out how to juggle that little bit of certainty, latch onto it, the uncertainty, not be too frightened about it, and sort of get on with life without being overwhelmed by this doubt. And there's a lot of doubt out there, and it's really, it's punishing. It's bad for our mental health. It's stressful, but we have to, I think, learn to, there's this expression, this mindfulness guru, John Kabat-Zinn, I often quote. He says, you can't control the waves, but you can learn to surf. And I think that's what people who've survived the pandemic well have done that. They've learned how to go with the flow. And that's what the guidelines are for me. I'll read them, I'll take them into account, but I'll sort of go with the flow and do what feels right.
André, thank you so much for this. Really appreciate it.
Thanks.
And that's it for today. I'm your host, Tamara Kandaker. The Decibel is produced by Madeline White and Kasia Mihailovich. David Crosby edits the show, and Angela Pacenza is our executive editor. Thanks so much to André Picard. You can find him on Twitter at PicardOnHealth. If you liked this episode, share it with your friends who've gotten their second dose, and leave us a review on Apple Podcasts. If you want to say hello, email us at thedecibel@globemail.com. You can also reach me on Twitter at anima_TK. If you haven't already, wherever you're listening to this, hit the follow button so you never miss an episode. Thank you so much for listening, and I'll talk to you tomorrow.